I want to say something about the connection to big society. Trevor sort of really was saying the work on community asset approaches to community development is in some way parallel and may kind of overlap with this. I like to think of big society with small letters. I like to think of it as very, very local. I think it's about the neighbours of Trevor's father having the kind of sense to keep on coming, even though the circumstances have changed a bit. But the way the service was offered got in the way of that. I like to think about how, in places, elected members working with people in their local areas come to understand the fine grain of health and what can be done using kind of all the local resources, including small business resources in the community, because we sometimes think that there's local government here and then there's a community and voluntary sector and then there's business somewhere else, but business is part of the community just as much. It's interesting, there are political traditions, I won't go into them in depth, that help to answer the sort of a difficult question, because when you talk about big society with big letters, the first reaction is, this is covering for the cuts. The second reaction is, it's what we're doing already, so why call it something else? There are thousands and thousands of voluntary organisations and groups already working at it. But there is, I think, a stream of political thinking that is about, if not the state, then what? And if not big business, then what? And it goes right the way back in each of the political parties to the early years of the 20th century and even further back, Disraeli as One Nation and so on. So there's a lot of kind of stuff there that feeds into this sort of expectation. I take it very simply. It's likely that we've gone as far as we can to generate improvement by central direction. And there have been some spectacular successes and some failures in that. But we've probably gone about as far as we can, and we've got to come at it from a different angle. And if we don't, we won't be as successful, perhaps. Okay, 3 things that councils can do. First is stand where you are. That is, do the things you're already doing and do them well despite the problem of, I don't know what the local figure is, 30%, sort of 40% coming out, I'm not sure, but a significant kind of reduction in your local budgets. But you do a lot of things that are really important, things that sometimes we don't think about, like regulation, consumer protection, environmental health, keeping going on the excellent things that have been happening around schools, building on the social care work, and trying to hold on to sufficient of your community development people and neighbourhood workers and leisure services workers to carry some of the weight during the transition. So that's standing where you are. I think you probably do need also to move downstream a bit. I don't know whether the word industrial is right, systematic probably is right. If universally GPs and hospitals were working to best practice in quite a lot of areas, the impact on public health would be very, very profound. So I do actually want the GPs to look carefully at whether they're getting the best possible results that they could be getting for the people on their patient lists. And I think it's part of the role of council through scrutiny to keep on asking that question. I don't think scrutiny is going to disappear, health scrutiny. I think there's probably a little bit of a kind of awareness around at the centre that the white paper just got it wrong around the placing of scrutiny into the health and wellbeing boards. And the Local Government Association has really very strongly said this does not feel right. It's just inappropriate. So I think that may very, very well shift. But in terms of moving downstream, there are just a lot of things that working together with health, local councils can make huge improvement on. And long-term care is probably the single most important thing to get right. If you can combine what the GPs know about their patients with what adult social care know about the people they're working with what the hospitals know about the people who are kind of bouncing in and out of the hospitals, and then you work on it in a kind of coherent and systematic way, the gain for individuals is enormous. The financial gain is also very, very great. And it should then allow resources to be freed up to move further down the pathway. But having talked about influencing behaviours and influencing health services for people who are already ill to some degree. I want to talk for a moment about moving upstream in the Marmot territory and just try and make very practical some of the things that Mike was pulling out. It's really just checking out that everything you're doing feels as though it's aligned towards improving health, as well as all the other things. And that's quite a hard act, you know. Teachers are teachers, but teachers also have a responsibility for the whole pupil. Schools have certainly taken up the challenge in many, many places about that. So it's actually just trying to get this alignment of activity across the whole of the council and the whole of the system towards supporting a healthy way of life in the local area. And that absolutely is central council business, because everything that touches on it in the Marmot view is the business of local government. It's already the business of local government. And you've been working on it even if you didn't know you were working on it. But the question now is to make what's tacit more apparent, and then to kind of make sure you're doing that work very, very systematically. And that's in the situation of some very strange labels that are put on the changes that are happening in local government. We hear, well, about some very obvious things, saving on duplication, working with organisations to take waste out of the system. Community-based budgeting, in a sense, is sort of about that. And there are shared service managers increasingly across the boundaries of organisations. The one I loved, actually, was an attempt to try and get HR between a local hospital and a local district council. That seemed to me to be the kind of invention that we would need. But then I get into these sort of labels that are just a little bit more difficult to kind of take account of. The pure commissioner model. Councils should only do the minimum that nobody else can do. They should buy their services elsewhere. They should go for some radical pluralism about that. And I suppose that's the Suffolk model. It's a bit of an exaggeration, but it's what Suffolk is trying to do. I know they don't like it, but I'm going to use the term. And we're far enough away from Barnet that I can, I think. But EasyJet Barnet. You get from your council the basics, and everybody gets the basics. But if you want more, you pay according to the extras that you want to get from your council. And then John Lewis, the Mutual Association, which is the model of a couple of the other London boroughs, I think Lambeth particularly, trying to kind of think of the whole of the community in some way, taking part in that activity. The interesting thing is, as far as I can see it so far, all three of them are doing the same sort of things practically on the ground. But the explanations about why they're doing them and how they're doing them are a bit different. We've made a journey. We started, I think, with consideration about what should the structures be, health and local government. We then talked about processes. We then talked about the alignment of our work. And we then talked about the outcomes. And the outcomes are very practical outcomes for the people who live in local government areas. They're not kind of the outcomes necessarily that the national data set would feel were important, but all of the stuff in the national data set is important for local people, but there's a lot more in there besides. So if health is everyone's business, and now it's the statutory business, it's to be the statutory business of local government in a much stronger way. What are you going to do about it here? We know you've got strengths because we've seen the JSNA, we've talked to local people, but you've got a lot to do because every council in the country has got a lot to do. And in particular, kind of thinking through how much do you protect your older people? How much do you invest in sort of preventing some of the problems emerging for the future around the young people not in employment, education and training? How do you get that balance? And what can you protect when your budgets are under the kind of strain that they're under to get the infrastructure right for the kind of community approach that in the longer term is probably going to be the only way of doing it. You can get so far by getting the GPs sorted out, all of them working to a consistent high standard. You can do so much through individual programs of work done professionally. But it's about hearts and minds and behaviours that change from the inside. And that is really difficult. And as Trevor said, you don't do it just by knocking on the door and saying you need to change. I'll stop there. Thank you.